Good afternoon. I'm Andrew Goodall, Chief Executive of NHS Wales. Today, as usual, I'd like to update you about how coronavirus is affecting the NHS in Wales. Generally, our health boards continue to be at green or level 1 status, with a couple of site exceptions. About 38% of our acute hospital beds are empty. That's around 2,600 beds. This is lower than last week because we are seeing a return to normal NHS activity. There are 493 people with confirmed coronavirus in hospital and a further 355 suspected cases. This is lower than last week, but similar to the beginning of April. There are 357 available critical care beds in Wales using our surge capacity outside critical care units. Around 60% are empty and available for use if required. 55 people are being treated in critical care for coronavirus. This is lower than last week. The majority of people being treated in critical care do not have coronavirus now, which also shows more NHS work is taking place. I'll say more about critical care in a bit. Up to yesterday, based on our operational data, the total number of people admitted to hospital with coronavirus symptoms since the outbreak started was just over 7,000. 464 patients have been treated in critical care across Wales. More than 5,000 patients have been discharged from hospital, and most people who have had coronavirus, of course, have not needed hospital treatment. I've been asked over recent weeks about how coronavirus varies across Wales. Community transmission is falling, although daily cases continue to fluctuate. Over the last week, there have been between 100 and 200 confirmed cases a day. There have been some recent increases in reported positive cases in the community in North Wales. This could be a late epidemic surge, but we believe it's linked to increased testing activity and targeting specific settings like care homes. These have not converted into a higher level of hospital admissions. Cases in hospitals and critical care beds across North Wales have reduced from their peak. The number of cases in North Wales has remained generally lower in terms of proportion of cases than other areas of Wales. I wanted to focus on critical care today. It's an area which has come under intense scrutiny during the pandemic, and one we look to understand the demands and pressures on the NHS. I want to start with some of the numbers from our critical care units based on NHS operational data. Less than 10% of people admitted to hospital with coronavirus are admitted to critical care. We originally thought this figure would be much higher. The average age of someone being treated in critical care is 56. You may have expected that to be older. The majority of people in intensive care with coronavirus are men. People are usually in hospital for only a day or two before they are moved to critical care for treatment. 3/4 of people in critical care are mechanically ventilated within the first 24 hours. The nature of this virus has meant that 85% of people received advanced respiratory support and 44% received basic respiratory support. Typical time for respiratory support is around 11 days. One of the reasons why we took the early decision to suspend routine NHS appointments and surgery in mid-March was to put in place exceptional arrangements to increase critical care capacity across Wales. Critical care is a very specialist environment, and I want to acknowledge the way in which staff from other areas of the NHS have retrained and joined critical care as part of our plans to increase capacity. It's also an area that benefits from the support of many different professionals supporting patients, including when they transfer out of critical care and need specialist support to continue their recovery. To date, we've been able to accommodate everyone who needs critical care. Working with clinical teams, we developed plans to triple our available capacity. At this theatres and other patient care areas. Critical care staff have really been at the sharp end of the pandemic, and I want to thank them all for their exceptional efforts and for the care that they have discharged, not just at the peak of the pandemic, but in our current environment. People with coronavirus can be very ill. In some cases, people have been on a ventilator for up to 3 weeks, as well as receiving support for their cardiovascular system and their kidneys. We know that coronavirus can be fatal, but we are seeing lots of people leaving critical care units and hospitals after many, many weeks of receiving the most intensive care that the NHS can offer. Recovery from coronavirus varies from person to person, but for those who have spent more than a few days in critical care, they will require significant ongoing support. Access to rehabilitation is essential. Even today, with 137 beds occupied, critical care continues to be under pressure and in some areas is operating above normal levels in surge beds. We have seen some exceptional efforts from the NHS to treat people in Wales. We don't want to throw this away over the forthcoming bank holiday weekend and beyond. For the time being, the advice remains to stay at home to protect yourself and your loved ones. Please continue to support our NHS and care system by following our advice to stay at home. And if you do go out, please stay local. Thank you. Diolch yn fawr. So I'm just going to turn to the remote questions that we have, as usual. And to start, I'm going to ask Adrian Masters for any questions he may have from ITV Wales.
Thank you, Dr. Goodall. Would you expect Wales to replicate that programme? If so, can you say how soon and how widespread those antibody tests would be across Wales?
Just reflecting back on last week there, at the time of the press conference were some reports at that time about the availability of the antibody test, and you'll have seen, Adrian, of course, that on Monday an announcement was made by the UK, but on behalf of all of the 4 home nations, that there would be access to antibody tests, and that was made clear on Monday in terms of overall announcements. I understand there may be some further information coming later today as you refer, but I would be expecting that we are able to continue to take advantage of a 4 nations approach in this area. And I know even over recent days, the Minister and officials have actually been in touch with the UK government on what some of these operational measures would mean. You'll appreciate that if there's an announcement later, we'll want to respond at that time. But yes, we would of course want Wales to be part of those collective efforts as well as focusing on what we need to do, particularly for our Welsh circumstances.
Thank you very much. And if I could ask about a separate issue, your response really to what the Older People's Commissioner has had to say today, and particularly her decision to refer the situation in care homes here in Wales to the EHCR. Do you think there is a case to answer? And with your position as head of the NHS in Wales, do you think the time has come for a single service, a single NHS and social care service?
I know that from a Welsh Government perspective, officials and ministers have a lot of very regular contact with the Older Persons Commissioner. I mean, coincidentally, I actually have a conversation next Tuesday, for example, which is part of our normal ongoing arrangements. I think we need to recognise how quickly we have had to respond over these recent weeks to a once-in-a-century global pandemic. And clearly what we have had to do is to respond at various stages to this outbreak, not least basing that on the advice that has been available in our system and the science that applies to this. But as I've tried to be open in the past about, we're constantly learning about this virus. I think it's important to reflect that we have tried to ensure that care homes and the social care sector have been always part of our broader thinking. So we have taken steps to support care homes from the outset of the pandemic, including asking for visiting time arrangements to be changed, providing additional help and support in respect of infection control, including local support from local health boards and also from Public Health Wales. Even during this week, I know homes that do not have any reported cases have been having twice weekly calls, for example, in terms of making sure that we are able to support them. And any home with an outbreak has a daily mechanism in place to make sure we're able to support it. But a lot of the advice we have to give is really about ensuring that the normal good practice and infection control measures are in place. Actually, the use of a test is simply a diagnostic mechanism to ensure that the right actions are in place, and I would really want to keep our focus on ensuring that it's those actions that we pursue rather than the testing regime for itself. On your point about social care more generally, going back to before this crisis, we had issued our strategic plan for the health and social care system in Wales, A Healthy Wales, and that is absolutely about aligning the NHS support and care alongside what we do within that social care sector. And I think there are many examples during our pandemic response where we have actually able to bring that strategy to life, and I think equally, Adrian, a lot of lessons that we can learn from this as well. Thank you very much. I'm just going to move next to Stefan Messenger from BBC Wales. Afternoon, Stefan.
Thanks, Dr. Goodall. Well, those comments by the Older People's Commissioner made in tonight's BBC Wales Investigates programme, which exposes the pressure put on some care homes to take in hospital patients that hadn't been tested for COVID-19 as the NHS attempted to free up capacity in the early weeks of the pandemic. In England, it's now been acknowledged that that policy of moving people from hospitals into homes without tests may have caused problems with the spread of the virus. Do you and does the Welsh Government now recognise that too? And will you apologise to the families affected?
I think that every death from coronavirus is a real tragedy for any family and for any loved ones. And whilst, of course, we know from the evidence about this virus that most people will experience coronavirus as a mild illness, it will obviously create serious illnesses in many, and that includes, unfortunately, that it can be fatal. And we do have responsibilities to ensure that we're able to support our most vulnerable. Some of the decisions that Welsh Government took, including areas like shielding, identifying that older people were at risk earlier on, is pretty important. And I'm sorry for any family that has had to go the experience of losing a loved one throughout all of this approach. I just want to rewind a few weeks to where we were in terms of our expectations for what we thought we would be responding to, and to consider that we were responding to a reasonable worst case scenario that was telling us that we were expecting over 26,000 deaths in Wales and needed to put in plans accordingly for that. Partly our response by creating capacity on the NHS side, including field hospitals, was part of that solution, but we needed to recognise that we had to prepare ourselves to save lives and to protect the Welsh population. And obviously, we've been able to avoid and mitigate that peak that was expected. I think that is because of the way the public behaved as well as our own actions. But we'll continue to need to make sure that the most vulnerable in our society are protected, and we will, of course, make sure we have ongoing relationships with the care sector.
Secondly, can I pick up on Adrian's question about the antibody tests, and particularly the ones that have already gone on sale in certain high street chains? There were words of caution yesterday from the NHS's medical director in England about buying those if you're a member of the public. What's the advice here?
Yeah, I mean, Stephen Powys will speak about this from a strong clinical perspective, of course, but I think we need to be wary of people's wish to understand whether they have had the virus or not, to make sure that they can access reliable tests. And that's why, on a UK-wide basis and working across the 4 nations, we've been developing proposals to ensure that those antibody tests can be accessed and be used. We have a threshold that is an expectation that we should have over 98% accuracy, and I would be concerned if people are accessing at lower levels than that, because what it may do is give some false results to individuals, and that might mean that it adapts their actions maybe. I think our strong advice, irrespective of antibody testing, however, is that we continue to need people in the population to understand the regulations, but also the criteria that were put in place. We still need people to socially distance. We need people to not have false assurance at this stage about what we need to do. And we're really clear about our plans to make sure that we are still asking people in Wales to stay at home and help us to protect our health and care services. Thank you, Stefan. I'm going to now move to Dan Bevan from LBC. Afternoon again, Dan.
Thank you, Dr. Goodall. Good afternoon. After the scenes that we saw yesterday in some parts of England with crowded beaches, is there fear amongst the Welsh Government and also from your perspective within the NHS of seeing scenes like that when lockdown restrictions are lifted here in Wales?
Yeah, I mean, obviously we are having to work with the public on any of the measures across the UK to hopefully ask people to use their common sense on any interpretation. Our perspective on Wales is really clear, and particularly ahead of this bank holiday weekend, the guidance is still to stay at home. If people do go out, then it's to stay local, and we want to make sure that we're able to continue a focus on this at this stage, because we do want to approach and be able to progress an exit from our current lockdown measures, and we don't want to compromise that by actually seeing difficulties arise within our NHS services, or indeed the community transmission rate or the reproduction rate, the R value, actually going up at this stage. I focused on critical care today in terms of my introduction, just to really recognise at the sharp end what some of our staff have been going through in terms of caring for patients. But it's been really interesting in Wales over these last 3 weeks or so to hear intensive care consultants, clinicians themselves talk about their worries that the public perhaps don't fully appreciate the positive impact that they've had, or indeed the dangers that we could still end up with a further increase in coronavirus across Wales. And as I've openly said in these press conferences myself, I am still worried that the modelling, even alongside how we exit from lockdown, could still indicate a second and possibly a third peak if we're not careful. So I know from a Welsh Government perspective, and certainly from a First Minister perspective, an ongoing cautious and progressive approach is really important, but we will continue to need to rely on the support of the Welsh population.
Thank you. And of course, from tomorrow, fines in Wales will be increased to nearly £2,000 for people who are found to be repeatedly flouting lockdown restrictions. But fines in England, of course, with fewer restrictions are higher. So is it a case of fines in Wales a bit too little and too late?
I think the general feedback is that the population in Wales understand the actions that have been taken by Welsh Government, and actually there is some reassurance about the approach that's been taken to take these modest steps forward at this stage. The police are generally reporting that the public is compliant in terms of our expectations in Wales, but I do think that when the First Minister committed to revise the fines, that was in response to some of the feedback that he'd had from the police commissioners in Wales and also from chief constables in respect of the need to have some mechanism to demonstrate that the public understood the seriousness of this in terms of what's happening in Wales, but also, of course, that we want to ensure that there aren't repeat offences as well. So at this stage, I would simply wish to thank the Welsh population, because generally people have been very compliant with all of the lockdown measures, but we also want to make sure that we are in a position to address concerns when they arise. Okay, thank you very much, Dan. I'm going to move next to Mark Smith from Wales Online. Nice to see you again, Mark.
Nice to see you again as well, Dr. Goodall. You mentioned at the very start of this press conference that health boards are operating at level 1 status, apart from a couple of exceptions. What are those exceptions? What level are they at? And why has this change in status occurred?
Yeah, I mean, I'm really aware that over these recent weeks, I've always been reporting that, you know, we're at level green, which means every hospital site is at the lowest level of escalation. We have 4 levels of escalation available. Level 4, red, represents the most significant concerns about pressures and demands on our system. We had this morning 3 of our hospital sites in Wales who were reporting level 2. So that's only a small rise in terms of the activity that's happening on those sites. All of those sites were reporting that they would expect to de-escalate by this afternoon, so they will expect to be at green level later on. But I think for me it's just a sign that we are seeing some recovery of some of our more normal access to our NHS services. And you know, hopefully that whilst sites are reporting that they have a pressure, what they also report are their plans and their actions to make sure that is lowered again. So I don't have a concern about that. For me, I'm hoping that it means that some of the messages that I've been giving over recent weeks for the public to understand that NHS services are available to be accessed and used, that we have some examples of that started to happen across Wales. But just to revert back to one of the examples that I've given over recent weeks, A&E attendances are still really operating down a third below what we would expect at the moment. And some of that will be for reasons that patients don't need to attend A&E and access. And on a couple of days, it's increased maybe a bit more significantly than that. But I still think we need to keep a focus on the fact that hospitals are there, as with the health service more generally, to provide support to the population.
Thank you very much. And secondly, we've heard reports of spikes of COVID-19 related admissions in some South Wales hospitals over just the past couple of days, including the Princess of Wales Hospital in Bridgend and Prince Charles in Merthyr Tydfil. Is that something you're aware of? And do we believe it could be related to the VE Day celebrations?
I don't think it's really possible to link them back to events, but I would say that when the public don't follow the criteria, we obviously are worried that there may well be examples that occur a couple of weeks ahead on the back of potentially community transmission that has been occurring. And I would really ask the population to continue to understand why lockdown measures remain important at this stage. I think the numbers are so small, Mark, that probably I don't see them as spikes as such. I think they would have been very small numbers, perhaps slightly noticeable given our recent period of time, but wouldn't be noticeable on a normal day. But I think it just really emphasises the point that we are putting in these measures for a reason. We are trying to make sure that reproduction value in the community and that the pressure on NHS services both are limited as much as possible. Okay, thank you, Mark. I'm just going to move to Adam Hale from PA.
Thank you, Dr. Goodall. Returning to the earlier question on care homes, do you accept that the NHS in Wales has put pressure on care homes to take in patients during the crisis?
Our approach to our health and social care system was to try to make sure that we worked it as an overall system, and I would like to feel that care homes themselves are an extension of a hospital environment, and we have tried to do that. It's why I mentioned our strategic plan for services in Wales. It is to make sure that we're able to look at the way in which the NHS works alongside social care at this stage. We have had to adapt our guidance along the way in respect of testing regimes, for example, and that would be true of both the NHS and also for social care and for care homes themselves. And when the evidence has altered and changes, and that advice has been given, we have tried to adapt it and change it. The social care sector and the care home sector are really an important part of our response to the population. We absolutely recognise that there are twice the number of beds that patients are in that environment than in an NHS environment, and it's really important that we provide the support that's necessary. But as I was indicating earlier, we've also tried to make sure that access to support and advice has been available throughout. There were changes to the rules around testing for patients being discharged from hospitals back in April. That was again based on the latest advice at that time, and I think from the outset we have tried to ensure that our PPE supplies, which have traditionally been NHS-based, have been available for us to distribute across the social care sector, including, of course, care homes themselves.
Thank you, Dr. Goodall. And secondly, we've seen reports of people, many occasions now, travelling from England after restrictions were eased there into Wales while the country's still in lockdown. Do you expect there to be any sort of impact on the levels of transmission of coronavirus because of these transgressions?
Well, I think we will be worried about a couple of things in terms of your question. I mean, first of all, I think we just need to be continually clear about what the Welsh position is and why we are taking the steps that we are. But clearly that will be difficult for some of the English population to understand that there are differences across Wales. Nevertheless, there is a Welsh position. I think the concern should be in two respects. I mean, firstly, of course, we have a duty to respect our own, to protect our own population, but we also have a duty to protect any visitors at this stage. And whilst Wales, we would normally at this time of year be welcoming many visitors, we obviously have to be really clear about our messages. I understand from feedback to the First Minister that where the police have needed to intervene and where they have stopped visitors to Wales and explained the difference in our regulations and the way things are being approached, that there's been a very respectful discussion and people have understood the need for them to return at this stage. But it's why our advice for the Welsh population remains that people, if they are going out, must stay local. And we will continue to keep that under review from a Welsh Government perspective as we approach the next review of the lockdown arrangements.
So do you think it will impact the levels of the transmission? Will it impact, hospital admissions and things like that?
Well, if there's any level of gatherings that are occurring in the current environment and people have to be very wary about their individual circumstances, there is obviously the potential for some of that transmission to occur. And I think it's why we've been clear at this stage why Wales is still making sure that it wants people to adhere to the social distancing rules and criteria that are in place, and there is that message about staying at home. So to reassure you, Adam, we will keep our eye on that, and of course we will monitor any of the prevalence levels that are across Wales. Okay, thank you very much. I'm going to move now to Rupert Evelyn from ITN.
Thank you, Dr. Goodall. Scotland have just announced that they are going to be easing some restrictions outside from a week today. England have obviously done it. Why are Wales dragging their feet on the outdoor issue, especially when your own advice says that coronavirus doesn't live for very long, maybe a matter of minutes outdoors?
There's ongoing discussion across the four nations about these approaches. My responsibility is for the NHS response in Wales and the way in which we take it forward, and we have our own contribution to make towards that in terms of advice that we give from the NHS system, of course the Chief Medical Officer's advice as well. The decisions on lockdown measures and how that is taken forward remains a matter for the First Minister and for the Cabinet in Wales, and they are making their own judgments based on feedback from our stakeholders, but also on the back of the evidence that we see in Wales at this stage. And we are very focused on making sure that the reproduction value, the R rate, is limited and that we're able to keep under 1 as much as possible. But we are also very focused on making sure that we track other measures, and for me that means making sure that we don't see an increase in hospital admissions, for example, or indeed admissions to our critical care units across Wales.
Just on the track and trace, you wanted that in place by the end of the month. I think you said you want a workforce of 1,000 to do it. How many of those 1,000 people have been employed, and what is the latest date you've heard in terms of the track and trace app and when that will become live in Wales?
So just to say, Rupert, you did cut out in the middle of that, but if I take the spirit of what you were asking about timetables on the test, trace and protect mechanisms in Wales, we are aiming to have that in place at the end of May. I think we need to recognise that these will be progressive arrangements that need to be put in place. At a time when there is lower community transmission taking place, the need for the contract tracers will be at the lower end than what we perhaps will need if there are other peaks in the future. We're particularly trying to use these next few days to be trialling and testing our approach across Wales, and we have 4 health board areas with local government stakeholders who have offered to do that, to work through some of the detail. And yes, we are in train in terms of our recruitment process for those individuals that are going to be necessary for this, some of whom actually are already employed by some of our local government partners in Wales and have experience, for example, because they are environmental health officers or they are involved in our health organisations. On the app side, we are linking up with colleagues from NHS England in particular and with the Department of Health and Social Care, and we have the opportunity to be using that app and working it through. I think that the timescales are more at this hands of our colleagues across the border, but I know that we are linking with them to make sure that we can take advantage of that when it's available, and I'm sure that they will make their own announcements on the precise dates.
Sorry, will it be available by the end of the month?
I can't comment on the availability of the English system at the moment and what those intentions are, so they would need to respond on that. But what I can say is that we are working very closely with them to make sure that we have access to the app and make sure that it is suitable for us in Wales as well. Thank you, Rupert. Okay, I'm just moving to Tom Magner from Carers World Radio. Thank you.
Thank you very much indeed, Dr. Goodall. Good afternoon to you. There's been a great deal of claim, counterclaim information, misunderstood information about patient discharges. Please can you explain as clear as you can the steps involved in discharging a patient who's had COVID-19 back into their own home, back to the unpaid carer who looks after them?
Well, of course, while somebody has been in our care in a hospital environment, they will have been going through the appropriate care and treatment that they need, the interventions necessary. And I think, as I was saying earlier in sharing some of our operational data with you, we obviously have patients who have been admitted to hospital, who've still been ill, but have not had to access a critical care unit or department. And I think for anybody going through an experience of having had coronavirus and being in a hospital environment would have been a difficult experience. What we try to do in many respects is to use many of our existing arrangements. We have care planning approaches, we focus on discharge plannings, we're looking for discussions to take place with family. We don't want there to be a lack of advice that's given when people are sent back. We need to facilitate the transport arrangements. We have to make sure that the community nursing staff are available. But I think your point, Tom, is it's really important to make sure that that family arrangements and certainly care arrangements need to feel that they are properly part of that discussion. Inevitably, it will be an anxious time for families. It will be anxious because of their loved ones, but I accept that when people have been through COVID-19 and had it as a patient, there will of course be concerns about the family members, about their own protection, of course. So I do expect that that is a proper part of the care plans and the discharge planning that takes place in our hospitals across Wales.
And in amongst all of that, what specific information is given to the unpaid carer regarding hygiene, how close they can get, and all those sorts of considerations that our viewers tell us go through their minds in this type of situation?
Yeah, so I would expect that level of conversation to take place, although I do accept, of course, hospitals are really busy environments, and we need to ensure that we continue to care for people despite caring for people at high volume as individuals and to respect those kind of circumstances. As an example, this morning, just ahead of the press conference, I was talking to my own Welsh Government team about proposals around rehabilitation and recovery. And you'll be pleased to note that in that, the focus was not simply about what it meant for health professionals. It was absolutely about focusing on that family environment that was needed to give people the reassurances, but also the skills that they're going to need for their ongoing support for their loved ones. Okay, thank you very much, Tom. I understand that Stefan Messenger has another question, which I think is on behalf of a colleague. Stefan?
That's right. Thanks for taking it, Dr. Goodall. It's just about the statistics that have been put out today about field hospitals from the Welsh Government. How critical a part have Wales's field hospitals played in the fight against COVID-19, or is their key role yet to come?
Yeah, thank you, Stefan. As I've tried to reflect over these recent weeks, they've been a really fundamental part of our preparation and been a necessary part of making sure that the NHS was going to be able to respond to the peak that we were expecting. We were seeing international health systems being overwhelmed by patients coming in with coronavirus, and it was really important to make sure that we were able to make some judgments about the necessary NHS capacity. The reasonable worst case scenario planning that's driven a lot of our work across the UK was translated into Wales, and we were needing to understand a very high level of hospital admissions, but also the fact that we were expecting there to be a very significant number of deaths as well. So back in March and into April, the NHS had to respond in matters of days to establish a level of capacity that we had never seen before. And of course, there are costs about that construction of those facilities, as well as ongoing costs as we go forward. But I would argue that those were investments in terms of saving lives and also protecting the Welsh population. And I'm genuinely concerned that we still need to have the flexibility of capacity if we see a resurgence of this virus, because over the course of the months to come, there is absolute potential to see a second or third peak, and that could well be higher even than we were seeing during April. Now, Stefan, I would hope that isn't the case, and we prepared for April, and we were able to demonstrate working with the public that we were able to reduce that peak. But they have been an absolutely essential part of our preparations at this stage, and will continue to be so over the forthcoming months. Thank you very much. Thanks. I think that completes the questions that we've had.